Hello, and welcome to Cuppa and a Case Study Bilateral Lymphedema Case Review. My name is Joanne Yao, and I am the Senior Director of Marketing for ImpediMed. This is a fun, informal 30-minute case study review with two very experienced panelists. Maree O'Connor, physiotherapist at Victorian Lymphoedema practice in Australia, and Adam Brown, Key Accounts Executive with ImpediMed. Feel free to send us questions at any time using the Q&A icon on your screen. We will answer as many questions as possible live, and we'll follow up on any questions we are not able to address live. We're also happy to offer certificates of completion upon request. To request a certificate, you may either respond to your registration confirmation email us at info@impedimed.com, or contact your local SOZO representative. So Maree and Adam, please come off of mute and on video, and I will turn it over to you.
Joanne, it's just not letting me come back on. It's saying you need to. There you go. Excellent. Thank you.
Hey Maree, how you doing?
I'm going well.
You got your cup up?
I have. There you go. I hope everyone else has as well.
I just realized in my apartment in Texas, I don't even have an actual coffee cup because I don't drink coffee, but I do have a green tea. It's not whiskey, Joanne. It is green tea. So that's all fine.
Okay.
It's a new one.
Yeah.
Excellent. So let's move on, perhaps, Joanne, to the next slide. Great. So I'll just give you a little bit of background on this case study before we launch into the SOZO outputs. So this particular lady is 52 years old. She saw me back in 2016. So the actual measurements are really from 2018 when I got my hands on the bilateral SOZO. She initially started at 197 kilos, so that's a huge anaesthetic risk. And she had a mixture of obesity, lymphedema, and initially we fitted her with below knee wraps to control her swelling. So she came to me about swelling. She didn't know much about her legs, what was going on, but one of her big problems was she had a lot of pain in her left knee, and she wanted to have a knee replacement, but the orthopedic surgeon said that really she was too big an anaesthetic risk, and her biggest thing was to lose weight. So she was heading down the pathway of a wheelchair at the age of 52, which is pretty young. So next slide. So she went on and she had been already, by the time I saw her, a roller coaster of diet programs, and decided that when she had her right mindset that she would have gastric sleeve surgery. And then following that, she threw herself into Pilates and saw an exercise physiologist. So she was really trying to, change her life. It was sort of like drawing a line in the sand. And she had to do that from both the physical and psychological perspective. Next slide. So we might just throw through these. So this is where she was, and obviously this is where she's gone to. Joanne, you can just keep putting them on, that's fine. So just gives you an idea of how she's reduced over that period of time, which is huge. And just from a psychological perspective, it's massive as well. So what I would like now, and 61% reduction in body weight is pretty amazing, and that impact on her whole body is significant. So let's hand over to look at the SOZO readings. So if we can change screens, that would be great. So here we are. You can see that I've really started those inputs, back from, I think if you scroll down, Adam, what was the first one? 28th of August 2018. Yep. So this is what you see when you go in to the client. And how about we open our latest one, which is on the 30th of July. So you can see from this, it opens obviously with L-Dex, and L-Dex is where we started. This is what we were about. We needed to see where we were going. And you can see the trend over time where she was obviously higher at the beginning. This is probably not an indicator of where she originally was. Her obviously swelling was a lot higher than this. So, but we couldn't capture that because we didn't have bilateral. But that's her left leg, which is still sitting in that, that sort of yellow zone at 8.1, but very manageable. If we scroll down to the right leg, and you can see it's at 7.3. So it's much obviously better than the left. So the left is greater than right. And that's probably important for us to remember when we have a little look at the body composition as well. So would you like to go, do you want to add anything to that, Adam, at this point?
I was actually going to ask you a question without notice, Maree. Obviously, you talked about taking measurements before we had bilateral on the SOZO device. So what sort of things were you looking at from an L-Dex perspective for this patient, just with the older technology, and then unilateral L-Dex? So how did you kind of utilize that?
I must admit I didn't. That's the honest truth.
Question answered.
So that's why I was jumping up and down for a long time, Adam, to say that we needed bilateral, because I didn't look at it as such. I suppose I could have looked at them both as unilaterals and did two of her, like a left and a right. That is a possibility if you've got the old U400, would you say? Would that be a way I could have done it?
Yeah, and that's what I thought you may have done here. But now obviously we have SOZO with bilateral, in that short, 30 seconds, you can get all that information really quickly. So I'm glad that you're liking the bilateral side for your patients. So
I can put anyone on a SOZO reading now, except unless they've got a contraindication, which is not many. So that's really good. You notice also we've sort of picked a spot for the baseline, but I could move that depending on where I think. A question for you, Adam, probably because I just set my baseline across the board, but can I change my baseline, have one baseline for L-Dex and a different baseline, obviously, for body comp, or not? Yeah,
you can. So you can go, you can see this little corner here, set as baseline. So you can select the measurement that you're after. We could even make the last measurement a baseline. And I think I had the absolute pleasure of having some interaction with this patient with you a week or so ago.
Yeah.
And we were looking at do we actually need to reset the baseline, at a certain point. It doesn't always have to be right at the very first measurement, because there's been so much change with this particular patient. Is it time to rethink and look at, do I need to reset a baseline from the 30th of July? And then it's almost like a new goal, a new program for this particular patient moving forward. So at any time you want to change that baseline, you definitely can.
Or do you think for the L-Dex side of things, would you look at what the lowest reading was of the L-Dex? So that's probably the least amount of fluid she's got, and set it there for L-Dex, and then you move forward from there. Yeah,
that's going to be your clinical decision. So ultimately, you can certainly do that. There's always going to be little fluctuations with the L-Dex result. Sure. But if you think something is changed significantly, so let's say it's this point here that we're pointing at 9th of August 2019, you could certainly reset that baseline and then work there. But I mean, she certainly the right leg, as it's pretty consistent on that baseline level, even from the very first measurement, 2018 to July 2021, there really hasn't been too much change. The leg that has more issues to deal with, I think certainly knowing what might have been back here as an initial baseline measurement would be useful, but you're starting to now see, as she's lost that weight, which we'll see in a minute on the body composition side, and I think a lot of the weight was really lost around these sort of areas. So maybe that is the baseline that becomes set, and then you're monitoring everything back to this particular point, if that makes sense. So
I think this is really important for clinicians, because we've always talked about the cancer world and looking at a pre-op measurement and setting a baseline there. Now, when we've got these people bilaterals coming in, we don't see them before they have swelling. Do you know what I mean? These are primary or obesity-related lymphoedemas or vascular, mixture. We need to choose that. And I think, as you've always said, it's never the first, you watch the trend over time. So don't feel afraid if you see it drop, that you think, okay, this is perhaps where they're more normal, that the lowest we can get, then we can look from there and reset. Yeah, absolutely. Okay, excellent. Body comp. Where do you want me to go next? Body composition would be great, thank you. Will do. So we're all about fluid, aren't we? So it's important when we take that step through, and this is what I do when I see a client. I start with the L-Dex, then I say, oh, look, let's have a look at your body composition. I get mixed feelings sometimes. Oh, I don't know about that. But I said, look, let's just talk it through and see what's happening. Go on.
I know we've got a short webinar, but that's a very interesting point that you bring up. If you had, and I've had that conversation over the last few weeks myself. So if your patient is saying that, oh, I don't want to know my body composition, I'm a little bit unsure, what's kind of your wording then to your patient, because it's obviously critical information for you as the therapist, So how do you kind of work through that little, I guess, objection from the patient?
I always look at it as it's not just about the L-Dex, it's just not about the fluid. The best we can get for your therapy is looking at the whole picture. So that's looking at your muscle and all that, because therapy is about exercise is a big component of it. So if I can look there, and the added bonus will be, oh, look, guess what? Your muscle mass is down. So you've got to look holistically. And I think I personally, I'll take this on board, is because we didn't have body comp before and perhaps have the detail that we have now, is I tended to focus a lot on the fluid in regards to the L-Dex, whereas now I just think I'm much better as a holistic therapist to look at whether, I'm a physio background, but if I was coming, say, from a nursing background, that's fine. I need to understand the data and then refer on as required, I think.
Yeah, awesome. Thank you.
So we have the total body water, which is really important. Actually, I would like you, Adam, to talk about the mean and just point out where we've come from, because we've actually set a baseline there, and I think that's significant. So do you want to just talk through how you've worked out this range?
Yeah, if you think about it, you've got like a standard deviation range, for a lot of the parameters with version 4 of SOZO. So you can see the latest measurement, this little black dot, she's very close to the mean of the population. So the mean of where I guess all the health population for her gender and her age and things like that, depending on which output it is. So she's really close to that mean, which is a good thing. This little black line here is where she started. So that's the baseline that you've set. So she's a long way from that mean of the healthy population. So she's right out near 3 standard deviations. So we know in terms of statistics, 3 standard deviations covers 99.7% of the population. 2 standard deviations is around 95, but when we're getting into this healthy range, around about 67% of the population sit there. So for someone like this, we ideally want, depending on what the parameter is, moving back in towards that mean of the population. For other people, it might be moving beyond the mean, depending on what their goal is. So it's quite interesting, where this patient kind of started from and where they are now. And it's interesting, this is total body water. So you're thinking, well, if you look at these raw numbers, she's lost 5.9 litres of overall fluid. I think we had this conversation a little while ago. Is that necessarily what we want to see or expected to see from a total body water result? But the advantage of having all of this fluid information is we can go then down into the extracellular, intracellular fluid level. And we know that, most of that fluid loss is in the extracellular fluid space. So over 4.1 litres. So that's a huge difference from the first scan, in 2018 to sort of 2021. So there's been a significant shift downwards in extracellular fluid. So that's bringing that total body water raw litre number down. But then when you look at it as a percentage, she's actually improved significantly as a percentage of her overall total body because she's lost so much weight. And we'll look at those sort of areas in a minute. So it's quite interesting, even off one little parameter, what information is it showing me? How can I use that clinically? But then I think the third piece is, okay, how do I deliver that message to the patient to get them to buy into what you're doing?
And that's why I think setting baselines is really important, because for us to say, even if you just point to the extracellular fluid baseline, just the line, see there, and we've moved back all that way to 44.2 is really powerful. Like, see how much you've moved. You've moved from way out there back into, into that normal population, healthy population. Healthy is an important word to use. The intracellular obviously had a little bit of movement as well.
Mm-hmm. Yeah, and I think what we always talk about, I always say, hey, if I'm young, fit, healthy, active 20-year-old, I'm going to see a 60% intracellular fluid, inside the cell, 40% outside. A lot of the patients that we're dealing with are not that. They're, 50% inside the cell, 50% outside. And even, when you look at the ratios of where this particular patient started, she was pretty close to that. So, just over probably 52% inside the cell, very high extracellular fluid. But look now, with the changes that have occurred, she's back in, I guess, what we would class as a pretty normal range. And the mean of the reference range is showing that. So 55 to 60% inside the cell, 40, 45 is kind of what typically we want to see. So she's moved well beyond, you know, those ranges, back into that healthy range over those couple of years, and the treatment that she's been given from your side, as well as obviously all of the weight loss and improving her exercise, including nutrition. It shows that you should see some really good changes in the right direction with the fluid side.
I've also said to her, you know, it's really useful. I always had in my brain that 60-40, which is sort of, you know, but now we have very specific age related. So it's good to target into that, I think, because rather than just be, you know, 60-40s for, you know, a young person, but let's look at what's real for you. So let's roll down a little bit to perhaps the L-Dex, just to have a little look at that. So we look at that, you know, how much, you know, fluid she's sort of drinking and etc. So she's sort of moved from being a bit less hydrated to more hydrated, would you say? Yeah. Yeah,
she has. And I mean, the quick point on L-Dex, I always say it's a very personal output, you know, so I can't compare, you know, Joanne's L-Dex score to mine, to Maree's, to somebody else. But once you have 1 or 2 or 3 scans, again, that trending is really important. But where am I trending based on my, you know, compared to my original baseline measure? And ultimately, we want people moving to the right. So we don't want people moving to the less hydrated side. We want them moving towards the more hydrated side. So that, again, is what's occurring in this particular patient. The caveat to all of that, and certainly this patient lost, you know, a lot of body weight. L-Dex does include weight as part of its calculation. So if you do have someone that loses significant amount of weight, you may tend to see that L-Dex shift a little bit more than normal. So that might be an opportunity then to reset the baseline, as we talked about before. So, but yeah, I mean, she's moving in the right direction on that front.
So when someone walks in, and sometimes they are way down towards the left when you measure them, and it looks like they're, you know, in that less hydrated, I tend to say, look, it's important for us, you know, it's all about fluid, that we make sure we're drinking enough, etc. Obviously, we don't want to tip people over the other way, that they're drinking all the time, but I tend to encourage them. But over time, we will see what their normal is as well, won't we, over a period of time?
Definitely. Yeah, once we get that trend, or the ability to trend. So once I've got 2, 3, 4 measurements, you're kind of finding what their normal is. And also the way our data set works, you'll have people that, you know, based on their height, weight, age, things like that, will sit on the minus side of that scale, and that's normal for them. Others will sit on the positive side. So that's why it's quite a unique number. I always say it's designed specifically for the individual. So, you know, are they moving in the right direction? It's a great way to see if they're following the protocol. So it gives a lot of information if used correctly. I think the power really is in the total body water, intra-extracellular fluid side. But L-Dex gives you that little bit of extra information, you know, really at a personal level. So that's kind of that fluid conversation. Do you want to move to muscle mass?
Yeah, exactly. So you can see, once again, hopefully everyone's now working out where to see that little baseline, which she was in 3 standard deviations, and now she's moved into -1 standard deviation. So that's she's moving in the right direction. But I think sometimes, and then if you look at fat mass, she's still in the very high. But I think, and this is where this particular client got a little bit disheartened, I think, to see that she's still in that pink zone. But when we had a look at it at percentage of weight, I think she understood where she came from. You would agree, Adam?
Yeah, I mean, again, there's 2 quick things to look at here. So we look at raw kilos, and I think you've heard me many times, and a lot of people that are on the webinar as well. Like, how do we make it tangible? So whether that's like I pick up a 20 kilo weight plate, or a big bag of peas, or to try and say, hey, that's how much weight you've got. That's the good stuff. How do we maintain and continue that? So you can see over a couple of year period, and losing, you know, kilos and kilos of body fat. You know, we've got, you know, a 40 kilo change in fat mass. You know, she's only really lost just a 1 little kilo of skeletal muscle mass. So that's an outstanding result, because it's very difficult to lose a lot of weight and not lose a little bit of skeletal muscle mass. I think that's partly to do with nutrition, you know, obviously the patient and their compliance to the programs, the exercise physiologist, your work as well. But as a percentage, as that weight comes off, look at what happens to the overall percentage. So she's actually improved 8.8% on the overall skeletal muscle mass side when you look at those particular numbers. And it's a -18.1% on the fat mass side. And as I said, 40 kilos of body fat. So my 220-kilo weight plate scenario, that's a lot of muscle fat mass coming off, and very little skeletal muscle mass, which is really exceptional. But does your patient get too disheartened by 36.5% body fat? What information can I understand as the therapist, and then how do I relay that to my patient? I think that's the real critical element, because we know we can get buy-in from her. And I think when we had the direct conversation with this particular patient, she was getting probably even too hung up on the weight on the scales. So we talked about the use of body composition. Hey, doesn't matter so much what your weight is every single day. I think she was weighing herself 2 to 3 times a day. So how do we break that kind of cycle, or that kind of mentality around weight? And body composition does that. Looking at muscle mass, looking at fat mass, all of those things become really critical to deliver that message.
Hey, Adam, on that note, we have a couple questions coming in from Q&A. First one for you is, it has to do with talking to patients. Do you guys have any suggestions on reasons for spikes or abrupt changes in body composition readings that don't necessarily fit with what's happening with that patient in real life?
Yeah, definitely. I mean, that can come up, and I think one of the things to look at is, what is our technology measuring first and foremost? So it's measuring fluid, and then obviously we're calculating muscle mass and fat mass. So the first thing, if I see a bit of a strange reading, is what was happening on the fluid side compared to the previous measurement. The other thing we can look at is the cold plot scenario. So with our technology, we first want to make sure that all of the cold plots when we did the calculation were correct. So when we talk body composition, our left whole body, right whole body data is really critical. So you can see with Maree's measurement, they're both high quality. If it's medium quality, depending on the patient, that may be okay. So if any of these are red, potentially we would retake that measurement. So that's I guess the science and the data side behind it. But if we go back to, do you
also look at the L-Dex as well?
Yeah, that's where I was going to go. So I really look at fluid. So I want to say, was today's measurement, were they in a similar kind of fluid status compared to the previous? So if there's been a significant drop in L-Dex, potentially it's not. So that can obviously start to interfere a little bit with muscle mass and fat mass, but it's a great opportunity to try and find out why. Talk to the patient, have that fluid conversation if you need to. So it's not a lost measurement, but you can really start
Adam,
to understand
what are you
what's
looking
happening
for in that fluid conversation? Because we got the question, if a patient has a low L-Dex, does this just mean lower extracellular fluid? Like, how should our users interpret, what are they looking for when they talk to the patient about fluid?
Yeah, so L-Dex is kind of a combination of all of those things. So that's where I would go back and look at total body water, extracellular fluid, intracellular fluid, and you can actually find out where that fluid loss has occurred. It may be a good thing if it's extracellular fluid loss. Has there been too much intracellular fluid loss? So there might have been a little bit of muscle drop off, which really you lose a little bit of intracellular fluid as well. So you almost need those three outputs to really determine what's going on, and we give you that information. And when we tick over to the segmental side, that's the power of segmental, because we can actually look at where that fluid was lost limb to limb as well. So certainly for a lymphedema patient, we can start to look at the limb and find out, has there been a significant change in intracellular, extracellular fluid, upper or lower body?
And it's funny, we got a comment. One of our viewers here has their own SOZO open and is looking at their patients during this webinar.
Oh, good idea.
Finding that very helpful. So thank you for that comment. And
that's a great idea.
Yeah.
So can we just look at just because I know we're going to run out of time at some point. Can we look at the percentage of the muscle mass versus the weight? Yeah. Because I think that's an important one that shows things going on.
Yeah.
So can we do a plot? Do you know what I mean? Can we look at it as
sure.
Thanks.
So what would you like to see, Maree? We have 6 minutes, but that's okay. We can get it done.
Yeah, and I know you guys want to talk about segmental, so we're getting some questions about lymphoedema.
Okay, we'll leave that at the moment.
Versus fat mass. So maybe you can talk about that too, Maree.
Okay. So let's go down. And that I think is important to see too, isn't it?
Yeah, so you can look at the weight drop off, right through here. The majority of the weight loss was in the early part of this particular patient. So you can see, and even that's where a little bit of the weight loss occurred, that the muscle mass occurred as well. As I said, it's very difficult to try and maintain all of that. But then as she's leveled off her weight loss, you can see that the muscle mass does start to improve a little bit. And we've talked about with this particular patient some changes in her exercise routine and habits that have actually maybe dropped off that skeletal muscle mass the last few months. So as a clinician, it gives you that information to really look at, hey, we need to think about what we're doing before. Has something changed nutritionally or exercise-wise that we need to reintroduce? And that's the power of knowing these particular numbers, straight away. So, but yeah, segmental. So, Maree, let's finish off with a little bit of a segmental discussion, because I'm really excited about this, and I've been learning a lot even the last few weeks, and I know you have. And there's lots of people that want to hear your thoughts. So
for this particular person, it's all over, obviously left and, arms and legs. But in particular, if you have a little, you look at I look at whether they're the same, left and right. I suppose that's important. That depends if it's a unilateral, obviously, versus a bilateral. So that allows me to have a little look and drill down, I think, into the numbers of the change in that particular limb. I think this particular one was quite interesting in regards to her phase angle, wasn't it, in her legs, which is the health of the legs.
Do you want me to give you my 30-second synopsis, and then you can follow on?
Yeah, sure. Go for it. Go for your 30 seconds.
We can spend 15 minutes looking at this data, so it's pretty cool, or we can do it in 30 seconds. But just for those who haven't looked at segmental before, and we do have some exciting news coming up for the Australian guys, so watch this space on segmental if you don't have access to that. But it gives us the same breakdown. So fluid. How much fluid this patient has in each limb, where is it inside the cell, outside the cell. So we've got no difference in total body water, left arm to right arm. We've got a pretty good ratio of intracellular, extracellular fluid in the left arm, 53-46, pretty good on the right arm as well. So we know there's a little bit more, as a percentage in the extracellular fluid left arm space, no difference in muscle mass. The lean soft tissue is muscle and all of the fluid. And also the phase angle between each left arm and right arm, the quality of the cell is pretty similar between left arm and right arm. When we look at the left leg, however, where a lot of the work needs to be done, you can see that the overall total body water is a lot higher on the left side than the right side. The ratio of extracellular fluid is actually higher than intracellular fluid on the left leg. There's no real change in the muscle mass. But the lean soft tissue is picking up that little bit of extracellular fluid. But what is really interesting is this is the last result. So the phase angle on the left side and the right side is pretty much the same, but the change from baseline on the left leg, 1 degree, is quite significant. So the quality of that left leg over the last 2 or 3 years has improved dramatically. And also I looked at earlier, the extracellular fluid when we started was up to nearly a litre extra on the left side. So we know there's been some great changes, but all of this data points to things are getting closer to that right leg, but there's still some things that need to be done on the left leg. So that's kind of my quick synopsis. How would you use that information?
I agree. I pretty much said it the same for her, how you said it. But I think it's really important for her to know that she has improved so much, especially the phase angle. So the things that I tend to look at probably in regards to anything would be your total body water, your extracellular, intracellular fluid. Obviously, previously, I would look at the fat mass as well. Skeletal muscle mass is my key. And the phase angle is a useful thing. I don't always talk about it at the beginning because I like to see what happens over time, unless it's really significant, saying, gosh, you've got a really good, healthy cells. But I think this just really allows people to look specific leg to leg. Obviously, if you had a unilateral problem, maybe this would be drawn out a little bit easier. But even for her, it's showing us what's going on. Yeah.
And what I do like, if you look at that left leg, I know we're just about out of time, but the left leg, and we know there's extracellular fluid, at a higher level than the right leg. If we go back quickly to the L-Dex, we're also seeing that follow the same pattern. So it's kind of giving you a little bit extra information to work with as a therapist to really find out exactly what's going on, where those changes were. Are there any muscle imbalances we need to look at? what's the quality of the legs, so the phase angle can certainly be used for that. So it just gives us that little bit extra information and helps cement your view as a therapist to make your clinical decision making, which is what we want, and buy-in from the patient as well. So yeah, I appreciate sharing that.
Yeah. Great. I think we're out of time, Joanne.
Yes, yes. Thank you, Adam and Maree. It's a wonderful 30-minute breakdown of a case on bilateral lymphedema, body composition, and segmental. So thanks everyone for joining. We have 2 more coming up that you can register for. We've got Brent Collier as well as Louise Kohlmeyer. We're going to do similar format, 30 minutes. So thanks everyone for joining us, and we will see you at our next webinar.
Thank you.
Thanks, Maree. Thanks, everybody. Have a good day.
Yeah.